If you have not yet done so, please review the basic principles section of this chapter before doing this tutorial. It is important to understand that the ability to perform all procedures under the scope is a learned skill requiring patience and practice. It is important to understand at the start that for the vast majority of the procedures we do, the patient is in the Trendelenburg position, the doctor is at the 11 or 12 o'clock position, and the microscope is in a vertical orientation and not in any way angled or obliquely turned. The videos you see on this DVD have been shot over a 20-year period in our office, and in that entire 20-year period, we have always worked this way. We learned very early in the process that moving the scope, changing positions, altering scope angulation, all these approaches decreased efficiency dramatically, and clinicians who work this way today never really get very good at microscopic endodontics, despite the self-promotional claims to the contrary. The key components to operating this way are this. Number one, a 6-step microscope that goes down to 2.2 magnification, allowing you to see the entire mandibular and maxillary quadrant at the lowest power. 2, a floating chair, one that is easily movable with the legs. 3, proper doctor stools with armrests. 4, assistant at the scope. 5, an ergonomic office design. And 6, an easily movable cart. In positioning yourself at the chair, take particular care to make sure you are not bent forward either at the neck or the back. To accomplish this, you will need to have the patient's head essentially in your lap, as seen here. If you have to bend forward, as seen here, you will develop lower back pain syndrome for certain. One of the learned skills is learning to move the patient chair with your legs and not move the scope, as demonstrated here. In the specific skills chapter of this DVD, this is covered in quite some detail. Obviously, moving the patient in this way cannot be done without an appropriate chair. The positioning for case presentations also depends on an easily movable cart and chair, as demonstrated here. Notice how easily the microscope is moved and how effortless it is to position the patient and monitor into a position conducive to good communication.